Far this week, since Sunday, 17 people with COVID-19 have died in Ontario, and the number of people requiring hospital care is rising. There are now 7,418 active cases of the virus. Of those people, 312 are getting treatment in a hospital. That's an increase of 17 since yesterday. We do know at least 18 patients are in local hospitals in Hamilton, Halton, and Niagara. Province-wide, 75 people now require intensive care, so 3 less people in ICU, and 52 people need a ventilator to help them to breathe. And locally, we're dealing with more outbreaks in long-term care homes and more deaths. Atkinson is live with the latest. Adam?
Thanks, Phil. The province says there are currently outbreaks at 88 long-term care facilities in Ontario, including many right here in our region. The health minister says the challenge is finding out how the virus got in these homes in the first place. There are now 15 cases of COVID-19 at the Chartwell Willow Grove long-term care home on Old Mohawk Road. 7 patients and 8 staff members have come down with the virus. Willow Grove is just one of 7 seniors residents in the city dealing with an outbreak. In Halton, the cases of COVID-19 continue to drop, but 2 more seniors have been killed by the deadly virus. One at the village of Townsley Woods in Burlington, where there are 42 cases of COVID-19, and one at the Chartwell Waterford in Oakville, where there are currently 29 cases. The health minister says tracking down how the virus got into long-term care homes has been difficult.
One of the concerns is that there's a number of links to some areas that are causing concern, but there's no real huge epidemiological link, so no known cause, which means that we have to follow more stringent public health measures.
Elliott points towards community transmission as a likely source.
That's one of the reasons why there has been a movement of COVID into some of the long-term care homes, and why it's really important that we continue to follow these measures so that we can stop this community transmission and therefore stop the spread in our long-term care homes.
The Premier didn't answer any questions about long-term care home outbreaks, but he did boast about the province's testing numbers.
But I just want to remind everyone we're leading the entire country, bar none, everything combined. We're doing more tests than anyone in the country. We're almost to 5 million tests the last 4 weeks. We've produced almost a million tests.
But there are some areas where we are amplifying our testing abilities with, in addition to the assessment centers that we have open, we've also opened up pharmacies for people who are asymptomatic but who need to be tested in order to go back to work in a long-term care home, for example.
In Niagara, there are currently 5 outbreaks at long-term care homes. And City of Hamilton officials tell me the outbreak at this facility is currently being investigated, and that all staff members and residents here are being tested to determine the extent of the outbreak.